KRON 4 going in depth tonight. Street drugs, opiates, heroin. All too often we talk about it as something that happens on a dark street somewhere else.
Yeah, but as we will show you tonight, it is happening in well-lit, prosperous communities. The Centers for Disease Control, they say it is an epidemic. Opioid deaths are up 33% over last year. New at 10, KRON 4's Vicki Liviakis shows us how this deadly problem is taking a toll on teenagers in Bay Area suburbs.
Joey, in my mind, was everybody's kid. He was the all-American kid. He was very, very much into sports.
But then there is reality.
Your son is gone. Yeah, my son is gone. My son is gone, and I can't tell you how devastating it's been. Unless you've lost a child, there's no way to really fully comprehend the depth of grief you go through.
There isn't a day that goes by that April Rovero of San Ramon doesn't wonder what she could have done to save her son.
The coroner I remember talking directly to let us know that typically for overdoses they see quite a lot more in somebody's system than Joey had. For him, that night, it was a lethal combination.
And I was taking 4 at a time, and then I started taking...
But just like these anti-drug public service announcements warn, while away at college, Joey Rivera overdosed on a cocktail of prescription drugs. According to the Centers for Disease Control, car crashes used to be the #1 killer among young adults, but now drugs moved to the top of the list. The National Institute on Drug Abuse reports more than 52,000 people died from overdose in 2015. Joey died of opioids, synthetic drugs that can have the same effect as heroin. And that's just the beginning.
All of a sudden, everybody I knew, everybody I grew up with knew about this, and everyone was doing it. Everyone was using it.
Bryant is from Concord. We're protecting his identity. He started snorting crushed opioid pills right out of high school. Soon he was smoking heroin, then shooting it, and didn't stop, even after witnessing the overdose death of a friend.
You know, I knew in the back of my mind that the substances I was using, the ways I was using them, could lead me down that road and could end up taking my life, but that's the first time I had really seen it. I had witnessed, I had first-hand experience with, you know, someone I knew dying because of this.
Bryant is smart, clean-cut, and an addict, a slave to his heroin high. He never thought it would happen to him.
You don't really have to look for junkies in the big cities or the dark alleys. They're right here in the suburbs. In fact, all you have to do is go to the bathroom medicine cabinet, and this is where heroin gets its first hooks in you, prescription painkillers.
They're scared. Parents they don't know what to do.
Nina Ferreras is the director of John Muir Hospital's Center for Recovery. She says many parents are at first shocked, then ashamed and afraid.
And they're just trying to save their children, and addiction has such a, you know, if their lips are moving, they're lying, and it's, you know, it's very dishonest. The addiction is a dishonest disease, and it does everything to protect the disease.
As for Bryant, he's facing the truth of his addiction and is currently in rehab. Vicki Liviakis, KRON 4 News.